Too many people suffer and die needlessly around the world. In our previous video, we introduced one of those suffering, the Mozambican lady in the corner. There are many reasons why she and millions like her are suffering. Our health systems are focused on curing health problems, generally without enough consideration of preventing health problems. There are also cultural norms and practices, misinformed policies, and lack of collaboration, all of which lead to gaps and inefficiencies in our health systems. Addressing these gaps seems overwhelming. However, by applying a few systems thinking principles, we can bridge the gap, transform health, and decrease suffering. Let's consider the example of Thailand from the book Good Health at Low Cost. While the world averages about 10% GDP spending on healthcare, Thailand has been able to surpass all Millennium Development Goals while spending a mere 4% GDP on healthcare. The big question is how? Public health leaders developed a new shared vision for health with political leaders and community members to provide health for all, especially the poor and those in rural areas. This eventually resulted in universal coverage of free prenatal care, skilled birth attendance, family planning, and immunizations by the early 1990s. Leverage points, small actions that lead to positive lasting effects, were identified that challenge current views of health delivery and led to care equality and efficient change to balance current health systems. One leverage point was the creation of a national nursing and midwifery training program that recruited locals from rural districts, thereby strengthening local capacity. Thousands of healthcare workers have been trained to provide basic preventive and maternal care in their own villages. Nurses, rather than doctors, emerged as the backbone of the health system, allowing Thailand to provide quality care to all for a fraction of the cost. Another leverage point was mandatory public service for medical, pharmaceutical, and dental graduates, giving the Thai people access to thousands of skilled health professionals. Feedback between policymakers and implementers of health programs has been essential. This collaboration allowed health workers to adapt to emerging challenges, ensuring effective program implementation. While the Thai health system is not perfect, the results have been impressive. An 86% decrease in infant mortality, a 12-year increase in life expectancy, and universal coverage of essential health interventions, all in just over 30 years. By applying systems thinking concepts, such as developing a shared vision, collaborating across disciplines, identifying leverage points, and utilizing feedback loops, Thailand has been able to provide health for all and increase the capacity of Thai citizens with very little external funding. We, as a global society, need to change the way that we approach every aspect of health to incorporate more systems thinking. We need a systems thinking revolution in health practice, policy, research, and education. We have formed a group called Systems Thinking for Capacity in Health, and we hope you'll join us for the sake of the lady in the corner and millions like her.